And speaking of pain, ever had one of those pounding headaches? Well, up next, an East Texas neurologist is here to make us smarter about migraines. Stick around. June is Migraine and Headache Awareness Month, so to make sure we stay pain-free, we invited Dr. Allison Hennigan from the Headache and Pain Institute. And Tyler, thanks so much for joining us.
Well, thank you very much for having me on this Migraine Solidarity Day.
Of course. It's good timing on our part.
Yes, absolutely.
Now, before we get into some of that, let's talk about how you got into medicine, because you were born and raised in the little town of Dickinson, south of Houston. So what made you want to be a doctor?
It's a lovely combination of the ability to communicate with people and to care about people, but also science. And so the combination of those two things made medicine a natural fit.
That sounds like a perfect profession for you. Yes. Now, nearly 20% of Americans have headaches that affect them throughout daily activities, work. I mean, it's a big issue. So what are some of these causes that are basically launching all of these issues?
Absolutely. So migraine is a genetic disorder.
Okay.
There are genes that put you at risk for migraine. Not everybody's migraines look the same. Migraine is the most common type of headache, which is why I'm focused on that. But there are other types of headaches, tension headaches, cluster headaches.
But migraine is the worst.
Migraine is well, worst is a questionable thing, but migraine is the most common.
Okay.
We'll say that way. Migraine is certainly the most impactful in our society.
Okay. Now, just to stop you, because I've never heard of a cluster headache. What is that?
A cluster headache is a headache that is caused, it is more intense than a migraine, but shorter lived than a migraine.
Okay.
And so
trying to decide which one I'd rather have with
neither.
that. Okay.
You would rather have neither.
That's the right.
Yes. So migraine has a genetic predisposition. So everybody has a threshold above which they get headaches. People with migraine genetics have a lower threshold and more things that push them over the edge.
Okay.
Like not enough water, not enough sleep, too much caffeine, too much alcohol. All of these lifestyle things that all the doctors preach are things that can absolutely impact a migraineur in a much more impactful way.
So when we think we're having one of these migraines, there's so much medicine out there, and people try to really medicate this issue themselves without ever consulting someone like you. Absolutely. So what are mistakes people are making when they self-medicate?
Oh, medication overuse headache is probably the biggest one. So anything that you take in response to pain can lead to a medication overuse headache where the medicine starts to cause the pain. This is notorious. Tylenol is notorious for this. Right. Any of the combination medicines like Fioricet, Fiorinol, those kinds of medicines, if you're taking them more than 2 days a week, you need to talk to a doctor about getting on a preventative so that you can prevent the headaches from happening instead of trying to take medicine in response.
So what would that look like if you were to go on that game plan, the preventative?
The preventative. So there are 3 phases of migraine treatment. Mm-hmm. Most people focus on, I've got a headache, I need to take something. Right. And what I try to encourage people to do is focus on prevention. And so moving to what can I do with lifestyle management as well as medications to prevent these headaches from happening. Then there's abortive therapy, but that's a different situation.
I got you. Okay, so let's touch upon a little bit this non-narcotic treatment.
So non-narcotic treatment is the bulk of all headache treatments because narcotics are in response to pain, and we try to get to the prevention aspect of things. So non-narcotic treatments can involve medications, lifestyle, as I mentioned, but also injections and nerve blocks because there are different nerves in the head that can serve as generators of headache. And so trying to get those nerves calmed down can absolutely help prevent the pain from going out of control. Okay, that makes a lot of sense. All right, well, we appreciate all your insight. Thanks for being here. Thank you for having me.
Of course. Now, we will have all this information on our website, cbs19.tv.